to have a good recovery and to be able to follow my instructions post-operatively, women need to be able to take time off work. They need to be able to be in the home with restrictions, usually on things like lifting, driving, cooking, cleaning, which can be a consideration for many women who have children or a family. They need to build that social support network.
So when I see my patients, we'll definitely have a conversation about certain things that I would need from them pre-surgery, right? So if they're smokers, we always want them to stop smoking. If they're taking any sort of medication that might cause bleeding, as long as they get cleared by their primary care doctor, I usually have them stop that. But more importantly, the recovery is just as important as the surgery itself. And I often tell them, your final result, 50% is what I do, right? It's what I do in surgery. The implant we choose, the pocket, all of that stuff. But the other 50% of your result is really going to be how you heal afterwards, right? And some of that is genetic, some of that we can't control, but some of the things that we can control so that you heal the best are really going to be preparing yourself well for that recovery period. And that can last 4 to 6 weeks after surgery. And that's really when your incisions are going to be the strongest. And so I'll have restrictions for you as to what you can and can't do during that time. Some of that could be, no lifting more than 10 or 15 pounds. So especially for my moms out there, if they have toddlers running around the house, they can't necessarily be picking them up and carrying them around everywhere in that immediate period. Also, I have a lot of patients that are dog lovers, and they have these big dogs that, they go out for walks and the dog is sort of like leading them. And so I'm like, okay, you probably can't do that because you can't have a dog pulling at you that's, a 50, 60 pound dog. So make sure you have help at home, essentially, so they can take your dog on walks or help with childcare. And then, just basic things like I have them stock up on sports bras, things without underwires, because I don't want an underwire rubbing against an incision if we do it under the crease or in the crease.
I'm Dr. Essie Yates. I'm a board-certified plastic surgeon located in Fort Lauderdale, Florida.
I'm Dr. Smita Ramanadham. I'm a board-certified plastic surgeon, and I have offices in Montclair and East Brunswick, New Jersey.